I'm Dr. Emily Carter, and today I'm going to reveal the ugly truth about some common health checkups that senior women over 70 often think are helpful, but in reality could be causing more harm than good. If you're over 70, you need to hear this before scheduling your next appointment. Watch till the end, because I'll also share safer alternatives and what you should be focusing on for your health. And hey, before we dive in, hit that like button. Comment below if you've had any surprising test results, and subscribe for trusted advice that puts your health first. 1. Routine PSA testing, prostate-specific antigen. For women, let's clear something up right away. PSA testing is a blood test designed to measure prostate-specific antigen levels, and it's strictly a test for men because only men have a prostate gland. Yet, I've seen cases where women are ordered tests that look similar or panels that include irrelevant hormone markers. Why does this happen? Sometimes it's a misunderstanding or a broad hormone panel that gets ordered without considering your actual needs. For senior women over 70, this kind of testing is not just unnecessary, it can cause significant confusion. Imagine getting a lab report filled with unfamiliar numbers that don't mean much for your health, but suddenly cause you worry or lead your doctor down an unnecessary path of additional tests or treatments. This is a prime example of overdosing, which contributes to anxiety, additional medical bills, and sometimes even harmful interventions that weren't needed in the first place. The takeaway here: always ask your healthcare provider to explain why a particular test is ordered. If it's not relevant to your age, sex, or symptoms, challenge it. Your health deserves precision, not scattershot testing. 2. Routine full body scans without symptoms. Now, full body scans like CTs or MRIs sound impressive. They're high-tech, they can see inside you, and many believe they're the ultimate way to catch any hidden diseases early. But here's the harsh truth. For women over 70 without specific symptoms, these scans often do more harm than good. Why? Because full body scans frequently reveal what we call incidentalomas. These are incidental findings, little spots, lumps, or irregularities that look suspicious but are actually harmless. Unfortunately, once found, these incidentalomas often trigger a cascade of more tests, biopsies, and even surgeries that carry real risks such as infections, complications, or unnecessary stress. For example, a tiny lung nodule or a benign kidney cyst can turn into months of anxiety and invasive procedures that didn't need to happen. Plus, CT scans involve radiation, which accumulates over time and may increase your risk for other health problems. So, if you're feeling well and have no specific symptoms, pushing for a full body scan just to be safe is not wise. Instead, targeted imaging based on symptoms or risk factors is a much safer, smarter approach. 3. DEXA scans too frequently. Bone health is critical for senior women, especially after menopause when the risk of osteoporosis rises. The DEXA scan, which measures bone density, is an essential tool to help identify women at risk for fractures. However, there's a common misconception that you need a DEXA scan every single year after 70. In reality, that's often unnecessary. The guidelines recommend a DEXA scan every 2 years or longer if your previous scans were stable and you have no new risk factors like recent fractures or medication changes. Why is too frequent scanning a problem? Because it can lead to overdiagnosis. You might be labeled with osteoporosis or osteopenia, a milder bone loss that wouldn't have caused you harm. This often leads to prescription of medications that come with their own side effects, like jawbone problems, unusual fractures, or gastrointestinal issues. Plus, constantly scanning your bones can make you obsess over tiny changes that don't actually matter to your daily function or quality of life. Instead, focus on lifestyle measures like adequate calcium and vitamin D intake, regular weight-bearing exercise, and fall prevention. 4. Pap smears after 70 without risk factors. Pap smears have been a lifesaver in detecting cervical cancer early, but they're not a one-size-fits-all forever test. After 70, If you have a history of normal pap smears and no risk factors, such as a history of cervical precancer or exposure to HPV, continuing routine pap smears often causes more harm than good. Why? Because pap smears after 70 often detect minor cellular changes that will never develop into cancer. But once abnormalities appear, women undergo more invasive follow-ups, colposcopies, biopsies, and sometimes treatments like cauterization or surgery. These procedures can cause pain, bleeding, infections, and scarring. For older women, tissue heals slower and is more fragile, so these harms are more significant. There's also the emotional toll, waiting for results, worrying about cancer, and dealing with the aftereffects of unnecessary procedures. The key is to have a conversation with your healthcare provider about your personal risk and history. If you're low risk, it's safer to stop routine pap smears and instead focus on other health areas that matter more after 70. 5. Full lipid panels every visit. Cholesterol testing is a cornerstone of heart health management, especially earlier in life. But after you hit 70, the approach needs to be smarter, not just more frequent. Many senior women get full lipid panels checked every time they visit their doctor, sometimes multiple times a year, even when their treatment hasn't changed. Why is this an issue? Because frequent lipid testing in stable patients rarely changes the treatment plan. It often leads to unnecessary worry when numbers fluctuate slightly. Remember, cholesterol levels naturally vary day to day. This can prompt your doctor to adjust medications unnecessarily or order more tests to chase abnormal results that aren't clinically meaningful. Moreover, aggressive cholesterol lowering in older adults can sometimes backfire, causing side effects like muscle pain, fatigue, or even increasing the risk of falls and cognitive issues. Instead, after 70, focus on managing your overall cardiovascular risk with healthy lifestyle habits like a heart-healthy diet, regular gentle exercise, and controlling blood pressure and blood sugar rather than obsessing over every lipid panel number. 6. Thyroid testing without symptoms. Thyroid health is often misunderstood, especially in older women. It's true that thyroid disorders are common in seniors, but testing should be symptom-driven, not routine. Many doctors order thyroid tests as part of a broad blood panel without asking if you have symptoms like fatigue, weight changes, or mood swings. The problem? You may get a diagnosis of subclinical hypothyroidism or subclinical hyperthyroidism, which means your numbers are just slightly off, but you feel perfectly fine. Treating these mild abnormalities often doesn't improve your quality of life and can cause harm. For example, thyroid hormone therapy can increase your heart rate, worsen osteoporosis, and cause jitteriness or insomnia. On the other hand, overtreatment of low thyroid can lead to atrial fibrillation, a serious heart rhythm problem, especially in older adults. So, if you feel well, don't push for thyroid testing. Instead, talk openly with your doctor about any new symptoms and get tested only if there's a clear reason. 7. Cancer screenings beyond guidelines. Cancer screening saves lives when used properly, but it's not a more is better situation after 70. Many women keep getting colonoscopies, mammograms, or lung scans because they think it's mandatory. The truth is, each screening test has an age or health status cutoff for a reason. For example, colonoscopy involves sedation and carries risks like bowel perforation. Mammograms might detect slow-growing cancers that wouldn't have caused problems during your lifetime, leading to overdiagnosis and overtreatment. When life expectancy is limited by other health conditions, or if screening risks outweigh benefits, it's time to have an honest conversation with your doctor about stopping or spacing out these tests. This allows you to focus on quality of life and avoid unnecessary invasive procedures or anxiety from false positives. 8. Vitamin and mineral panels without deficiency signs. Blood tests checking every vitamin and mineral in your body may seem thorough, but without symptoms, they're often a waste of time and money. Excess supplementation based on minor or borderline test results can be harmful. For example, too much vitamin A can cause liver damage and bone pain. Excess iron can promote infections or heart disease, and high doses of calcium supplements have been linked to kidney stones and heart risks. The best approach? Pay attention to your diet, take a balanced multivitamin if recommended, and only test vitamin or mineral levels if you have symptoms like fatigue, numbness, unusual bruising, or specific medical conditions. Testing without symptoms often leads to overtreatment and confusion.